We're going to talk now about a fascinating illness called EMF syndrome, also known as electromagnetic hypersensitivity. How many people in this room, if you've got to work on your computer for a few hours, or if you've got to, stay on the phone, or people who use a portable phone because it's so handy, isn't it? But it's an absolute disaster, because if you put that portable phone to your ear, you are in big trouble. How many people notice the sensitivity in this room? Absolutely. Absolutely. Okay. But some people are exquisitely sensitive to the point that if they know if you have your mobile phone on in your pocket. Okay. I have a lady that Raymond and I have been looking after in southern Tasmania who went to live there because she initially had chronic fatigue syndrome, which some people in this room may well have had, because my experience is that the people who are electromagnetically sensitive and who have multiple chemical sensitivity syndrome, the chaos starts with chronic fatigue syndrome. There's a dysfunction of immunity and a dysfunction of the mitochondrial system, which means they haven't got energy to detoxify. They haven't got energy to think. The liver isn't working. The bowels aren't working. The muscles aren't working. Okay. These people, in my experience, are hypersensitive to electromagnetics. And in the Swiss study, they found that a lot of people who answered that they had symptoms, base stations were the biggest culprits, cell phones, obviously cordless phones, and high voltage power lines. And absolutely routers, Wi-Fi routers, yeah. But at the time, Wi-Fi routers weren't out. Okay, but this is a much maligned illness. If you go to Wiki and you read about electromagnetic hypersensitivity, these people are considered to be psychological misfits. Their symptoms are all made up. They've got a somatization syndrome. Basically, it's a polite way of saying you're off your face. You're not, this is a psychiatric illness. However, the Austrian Medical Association, who I applaud, I think they're the first medical organization who realizes that there is a problem. And the problem is that these people are having genuine symptoms. And as I said, you can see chronic fatigue, multiple chemical sensitivity, fibromyalgia, and there is actually a biological mechanism. And that's what I'm actually going to talk with you today. And the mechanism is what we call, we all know the word oxidation. You know what happens if you leave your car down at the sea? It rusts. And what is rust? It's oxidation, it's damage, it's breakdown, it's destruction. Well, we get destroyed, we get damaged, we get broken down by oxidative and nitrosative stress from the combination of superoxide and nitric oxide, forming this insanely dangerous substance called peroxynitrite. And peroxynitrite is a biological terrorist. It basically blows up and destroys. It leaves a path of destruction. And when this happens in our brain, we have neuroinflammation, neurooxidation, neurodegeneration. How would that make you feel? Do you think people would complain of nausea and dizziness and headache and lack of energy? 100%. And in Sweden, as I said, the EMF syndrome has been recognized, and they now have a special resolution. It's part of the UN Charter, and employers who have got electromagnetic hypersensitivity get special compensation from the Swedish government. I wish our government would see what the Swedish government are doing and look after the thousands of people who have electromagnetic hypersensitivity, because these people are suffering extraordinarily, and they get turned away from GPs, they get turned away from specialists, and they have no one to turn to. If you can't trust your doctor, who can you trust? You don't know where to go. And so the Austrian Medical Association has an algorithm for these patients, and it's the obvious things. You do a thorough history, you examine them, and then you do specialized blood tests. Geez, my hand is actually burning from this thing. Unbelievable. Unbelievable. Okay. They have a protocol for doctors how to assess patients according to their EMF exposure. These people have sleep problems, fatigue, exhaustion, lack of energy, restlessness, heart palpitations. There's a wealth of biochemical data we can get from our patients. Beyond, when you go to your GP, they do the basic. They do full blood counts, they do urea and electrolytes, they do liver functions, they do a vitamin D, they do a B12 and a folate. If you're lucky, you'll get a homocysteine. You'll get a TSH, a thyroid-stimulating hormone. And if you've had issues with weakness and fatigue, you may get your iron studies done. But that's basically it. And if that comes up clear, you're good to go. Irrespective of your symptoms, you're good to go. Now, that for me is not good enough. And so I've studied long and hard to research this. And this group, like the Austrian Medical Association, introduces us to all these new tests that are available. We look at, I'll get my cursor over some of these things like intracellular glutathione levels, myeldaldehyde, it's almost unpronounceable, which is a free radical marker. We look at some of the, we look at 8-hydroxydeoxyguanosine. I'll be discussing this in a moment. This is a DNA damage marker. We've actually got a marker that can show the degree of damage to your very DNA, to your very genetic code. Scary stuff. Okay, I'll just try and skip through. And so again, they give the low frequency references, and you can see in the upper left-hand corner, so greater than 400 nanotesla. Remember, nanotesla, which is greater than 0.4 microtesla, they say is very far above normal. And that's in line with those leukemia studies. So when you're looking at magnetic measurements, anything above 0.4 is a problem. Whereas when you're looking at low frequency alternating electric fields in the middle, we're looking at volts per meter. And they say above 10 is very far above the reference range. And again, less than 0.3 would be considered okay. And what we deal with all the time are the high frequency, radio frequency fields. And here, as we're now learning, greater than what amount is dangerous? Greater than, okay. So greater than 1,000 would probably put you in harm's way, but it would be best to have exposures less than 10, and for children, probably even less than 1, down as low as 0.3 microwatts per meter squared. Okay, so, wow, okay. So what do they suggest? They use the word disconnecting. We're always trying to connect. For once in our life, we're going to disconnect. So when you go to bed, you disconnect as much as you can. You even go to the power box and turn off the switches in the power box. You turn off circuits. The last person who goes to bed turns off the Wi-Fi if you have Wi-Fi in your house. You never keep your mobile phone on you. You keep it always as far away from you as possible. If you have to have it on you, I've got this extraordinary case. I've got this extraordinary case that completely cuts out any radiation to my body. So I can put my phone in the little side pouch like that, put it in my pocket, and I'm safe touching it. But I can still get a signal through the top. So we got all these amazing little things that keep us functional, connected to the world, but keep us safe at the same time. There's a company down in Melbourne that has this. Obviously, I'm not here to spruik any companies or any systems, but it's out there. The technology is out there. And what does Openza say on EHS? Well, they say there's no causal connection between the term electromagnetic hypersensitivity. They're happy for people to have the diagnosis of EHS, but they say it's not in any way connected to radio frequency electromagnetic energy. Okay. And that these people may be part of a disorder called central sensitization. And by now you know that that's a problem. So they do what they call provocation studies. And the provocation studies are when you expose an electromagnetically sensitive person to an unseen, seemingly unfelt field. Obviously, you can't see the field because we can't see radiation. And they want them to say yes or no whether the field is on or off. And they call that, so correctly discriminating is called electromagnetic sensibility, and getting lots of symptoms is electromagnetic hypersensitivity. But fascinatingly, the authors of this particular study said that although electromagnetic sensibility may be a necessary precondition for EHS, it is certainly not sufficient, as there is evidence that healthy individuals can display heightened sensibility without necessarily experiencing symptoms. So you're doomed if you get it right, and you're doomed if you get it wrong. This is how sometimes, dare I say, corrupt research can be. So let's look at the stuff that I'm passionate about, which are the biological markers. Because when you've got a biological marker, you take it out of the realm of psychology, you take it out of the realm of somatization, you put it straight back to the biology of the person, which you can't change. You can't change these numbers. Okay, so what they found, reliable disease biomarkers that came from the Bell-Poem study, was that histamine levels are increased. What is histamine? Histamine we normally think of as an allergic reaction. Kids who get, all of us, you may be stung by a mozzie, and there are a lot of them up here in summer, or you may get stung by a bee. You get a swelling, a redness, and an itchiness. That's the release of histamine, driven by an immunoglobulin called immunoglobulin E. So they find that histamine levels are increased in EHS sufferers. A substance called nitrotyrosine, which is a marker of oxidative stress. It's basically that extraordinary substance, dangerous substance called peroxynitrite, damaging brain proteins and releasing us, and then this damaged protein is called nitrotyrosine, which you can measure in the blood now. There's a substance called protein S100B, which is in high levels when somebody has what's called blood-brain barrier permeability. The brain is sacrosanct. God, existence, nature made the brain to be safe and protected, not only from outside dangerous influences, but from the body as well. Nothing gets through to the brain unless it's determined to get through. And when blood-brain barrier permeability increases, it means that toxic substances from the body can get into the brain and pollute the brain. And what happens is we now have a marker for that. Blood-brain barrier permeability goes up in people who've got traumatic brain injury, who have been exposed to extreme toxic substances. Believe it or not, EHS is a toxic, electromagnetic radio frequency is a toxic substance. Hence the first slide I put on, which was toxic biology. We can be poisoned if the field is too strong, if the closeness to the emitting source is too close, and if we're in it for too long, we can then have these dangerous markers going up in our blood. O-myelin autoantibodies go up. What are autoantibodies? Autoantibodies are substances that the body starts producing to attack itself. The body is attacking itself. Exposure to electromagnetics can cause damage to cells such that when they reproduce, what comes out is not a normal cell anymore. It's what's called a dysfunctional epitope. It's a cell that doesn't perform the functions it's meant to perform. And so these O-myelin autoantibodies. So what's O-myelin? Myelin is the sheath around our nerves. If we've got antibodies to the sheath of our nerves, what do you think that means? It means the conduction through our nerves is affected. The ramifications are enormous. We've probably all heard of the word melatonin. What is melatonin? It's an extraordinary hormone produced by the pineal gland. And melatonin is almost like the master hormone of the gland, of the body, nourishing, supporting, protecting. Not only does it correct our circadian rhythms, but melatonin is a standalone antioxidant, a standalone anti-cancer agent. A most extraordinary substance. Now, what has been found in 100% of the subjects measured in this particular study of 727 people, every single person had reduced levels of melatonin. The authors also did you've all probably heard of or done or had an ultrasound investigation where you can actually do ultrasound of the cerebral artery. The study is called a tomosmigmography. Ridiculous word, but basically measuring the perfusion of blood across the cerebral vessels. What they found is that there's a difference, that there's hypoperfusion, not enough blood going into the capsulothalamic area of the brain, suggesting an inflammatory process. And so in the new Bell-Poem paper, just published, if you look at the bottom, like just a few weeks ago, They've also found now that thiobarbituric acid reactive substances are also raised in these patients. We've spoken about MDA, which is also for, it damages fats or lipids, so we call it's a measure of lipid peroxidation, but also glutathione, which is our body's major defense antioxidant, levels of what we call reduced glutathione. It's almost like an oxymoron, reduced glutathione, but reduced glutathione is good glutathione, as opposed to oxidized glutathione, which is bad glutathione. So the ratio between reduced glutathione to oxidized glutathione drops, which is not good. That means that all our good stuff is being used up and there's very little left. 30 to 50% of EHF sufferers had raised T-bars, raised MDA, raised oxidized glutathione, and raised nitrotyrosine. And glutathione-associated biomarkers, the good unused glutathione was reduced. Okay, and additional markers like vitamin D. I think I can put my phone down now. Are you enjoying this stuff? Great. Okay, so we can also do levels of vitamin D, we can do levels of circulating IgE, we can do what's called high sensitivity C-reactive protein, and 71.8% of EHS sufferers have at least nitrotyrosine or IgE or protein 100B elevations. And so that's why I say this is a biological condition. And remember, these guys are the canaries. They're at the forefront. They're super sensitive and they're being affected now, which means that, God forbid, we're all going to be affected at a later date. So we need to take heed of these people, look after them, protect them, understand what we don't understand yet, and make sure that it doesn't affect us. Let's look at some of I've actually been working with a laboratory down in Melbourne, and we've actually got these tests. They are in Australia, and they are ready to go. And these are obvious. One can get the top ones in any laboratory, like HSCRP, vitamin D, IgE, and histamine. But what you can't get, the nitrotyrosine, the heat shock proteins. I haven't spoken about heat shock proteins. Heat shock proteins are like our biological angels. When something goes wrong, they're out there protecting us. They're preventing our cells from going through what's called apoptosis, which is programmed cell death. They're making sure that we stay on track and we stay on the path. And what happens is the body has this amazing sense of adaptability. So what happens is when we're exposed to oxidizing stress, our heat shock proteins go up. But when you're chronically exposed to oxidizing stress, what do you think will happen? They will drop. And then we get absolutely hammered. So the longer the exposure time to oxidizing stressful influences, the more strain you put on your body, and the body begins to decompensate. Okay, and so also from Belpome's paper and from the European paper, European is the European Academy of Environmental Medicine. There are some damage markers. We can do what's called the cytokine panel at the bottom, which are these immune inflammatory markers, and many of these are often raised. So we basically discussed this already. Neuroinflammation. I've spoken to you about melatonin and how it drops precipitously. That in the new Belpome paper, they discuss EHS and MCS. Remember, MCS is multiple chemical sensitivity as possibly being what they call a sentinel pathological disorder, meaning that after doing a meta-analysis, which is taking all these multiple studies and looking at the central themes amongst them to see if they have any objective statistical significance, that looking at 22 studies for prolonged exposures to extremely low frequency electromagnetic fields, that there was a very high association with Alzheimer's disease. Scary stuff. And what they suggest is EHS and MCS need the World Health Organization International Classification of Disease status, called the ICD, because once they receive the status, then this will be the basis for clinical and pathological description. It becomes a bona fide condition that then goes out through, legislation, and people can be looked after. So this is what happens. I had a lady through Steve who said to me, look, I suffer from EHS, and I had this test done. This is what's called a functional MRI, magnetic resonance imaging. There's a different, MRI is like a sophisticated form of a CT scan, but there's a component of it where we can actually look at the moment-to-moment lighting up of the brain in different areas. That's called a functional MRI. And without doubt, 100% of patients who proclaim to have electromagnetic hypersensitivity all had a most unusual pattern in the front of their brain. And so again, this attests to the fact that there is something really happening. We've spoken about the standard. Okay, so the interphone study. So Victor spoke a lot about the interphone study, and I will reiterate what he said. This was a study done across 13 nations. They looked at about 2,500 people with glioma and an almost similar amount of meningioma, 2 different brain tumors. But unfortunately, this was a case-control study, but unfortunately it was a study, a retrospective study, where they were simply looking at whether people were subscribed to a telecommunications company. But at the same time, they did look at the amount of time they spent on the phone, but as we heard, in this day and age, we spend much more time on the phone. They actually cut off, they truncated people who said they spoke for more than 5 hours. They said, that's impossible, and they truncated that. So if somebody spoke for 12 hours, they said, you can't speak on a phone for 12 hours, so we'll do a cutoff at 5 hours. And then the extrapolation of the data. So there's, unfortunately, we would hope that a scientific study cannot be sort of changed or altered, but unfortunately things like this happen. The long and the short of it is, irrespective of how this was truncated and shorted, greater than 10 years and more than 1,640 hours, there was an increase. There was a 33% increase of brain tumors, and that was on a very a small amount of talk time and length of time on the phone and the overall number of calls done. So confounding variables. Okay. Interestingly, the ORSAA epidemiological update, they recognize that there was a small increase in certain kinds of brain cancers, but they say amazingly, they agree, limitations of the methodology, including recall bias of phone use, prevented conclusions of causality. Their recall bias was the patient didn't know which side of the ear they used their phone. So the ipsilateral side being the side where the tumor was caused, and being the same side as where the phone was held, it was thought that there was bias. I mean, how do you not know which side you're using your phone? Okay, so also the acoustic neuroma. The acoustic neuroma is a tumor in the ear area. The data on this was withheld for 7 years after the study was completed. And the data again showed that there was an increased risk of acoustic neuroma. And remember, that's on very limited talk time. So yeah, for me, you've got to be kidding me, because only 10% of the subjects had additional telco phone records. Only 10%, not 100%, only 10%. And believe it or not, the study showed that people using mobile phones, regular users of mobile phones, and a regular user could be somebody who you were classified as a regular user if you used the phone once per week. Once per week? Okay, once per week. 12 times a year. Or was it 12 times? It would be a bit more than that, about 50 times a year, but once per week. Okay, and they were considered regular users. Okay. So it must have been once a month. It was once a month, because as little as 12 times per year. Okay. Irrespective, it was ridiculously low, and they're comparing those people to high users and expecting to get a normal result. You're not going to get a normal result. Okay, so let's go through this. There's an extraordinary gentleman called Lloyd Morgan in the US. He's an electronics engineer. He's written a treatise on this interphone study. It's been co-authored by people, and it's been endorsed by world-leading experts, medical experts, professors, even professors in Australia, Vinnie Kurama, Professor Charlie Teo down in Sydney. and another whole page of endorsements. And he did a 15-point concern as to the relationship between cell phones and brain cancer. And I'll just go through them very quickly. Industry knows that phones cause cancer. There's internal scientific data on this. But also industry-funded studies, more often than not, show no relationship between cancer and cell phone use. Let's see what else I'm going to pull out. I'll move through that. Okay, this is fascinating. Independent research shows that there's an increased risk of brain tumors. Professor Hardell in Sweden found that the risk of tumors increases every greater than 10 years, and this we've heard, not only from cell phones, but from cordless phones as well. But for every 100 hours of cell phone use, the risk of brain cancer goes up 5%. And for every year of cell phone use, the risk of brain cancer goes up another 8%. And more than 10 years of use of digital phones, 280% risk of breast cancer. And our children are even more at risk, being 420% increased risk. Okay, and then he goes through systemic protective skewing of the data. Simply said, fudging of the data, dare I say. Okay, and then industry-funded studies we've discussed. Okay. All right, and so on and so forth. I think you get the message. Okay. So let's move past this. Okay.
You have more than 100% chance of getting brain cancer. That says you will get brain cancer.
Well, you know, we're all very adaptive, amazing people. And we do the most. We eat well. We try to go to sleep early. We try and avoid chemicals and poisons and pollutants. And so we can epigenetically change a risk from a severe risk to a minimal risk. We're not all genetically the same. So some of us have poor antioxidants and some of us have amazing antioxidants. I climbed. I have a friend with me here. We were in Northern America, and I climbed the beautiful mountain, Mount Rainier. And the leader of the climb smoked 20 cigarettes a day. And I went, my God, are you crazy? And he'd climbed Mount Everest smoking 20 cigarettes a day. So is that a good thing or a bad thing? Clearly it's a bad thing, but he must have had amazing antioxidants to protect him from the risk of those cigarettes. That doesn't mean to say that any of us should ever smoke, but it means that some of us are well endowed in some areas and we're poorly endowed in other areas, and you've got no idea unless you test yourself out. And we can now do that. We can actually test you from A to Z, and you can find out how good or how potentially at risk you are. Okay, so we're almost there, guys. You've been amazing. Thank you for listening. Okay, so, okay, do you know what, guys in the room? When you've got your mobile phone in your pocket, guess what's happening? Okay, we're poisoning the very organs that we need to, that, you know, if we are still able to have children, the chance of that happening is very much less. When we look at a study performed by Dr. Agarwal, the study looked at sperm quality and sperm amount, and I don't know if it's very clear, but you can see as the time exposure to electromagnetic radiation increased, the amount in the middle here, let me get my cursor over it, the amount in millions of sperm dropped from 85% down to about 50%. The motility dropped, the viability of cells dropped from 77 down to 42, and the morphology of normal cells dropped from 40 down to 18% as it went above 4 hours. Okay. Again, this is an animal study. When they exposed, somebody in the room mentioned about Wi-Fi, when they exposed animals to normal Wi-Fi, you know, at 2.437 gigahertz Wi-Fi, 24 hours a day for 20 weeks. What they found was, remember I mentioned the DNA damage marker called 8-hydroxydeoxyguanosine. They found that marker increased in the blood. They also, when they sacrifice these poor animals, the 8-hydroxyguanosine, which is a tissue measurement of the same substance of damaged DNA, was significantly higher in these poor animals. But also their antioxidant substances, catalase and glutathione peroxidase, were reduced. Okay, so you're going to sleep with your Wi-Fi router on tonight? Okay. So let me talk about these amazing people. These are dedicated specialists who have dedicated passionate and valuable service to protecting fellow human beings. They're part of a group called the Bioinitiative Group. They're international academic medical experts. And also some non-medical experts, and it doesn't mean that if you're medical it's any better than anything else. We're all experts in our area of expertise, and we all contribute. But these are specifically to do with illnesses, and what they found is that they put together thousands and thousands of research studies which show beyond any shadow of a doubt the extremely harmful effect of electromagnetic radiation. And their work has assisted the European Parliament for policy decisions in recognizing the harm of EMF. So the Bioinitiative Group are working tirelessly to try and educate and to inform at all levels of society the risks of radio frequency, and also extremely low frequency magnetic and electric fields. And as I said, they put their protective level at 0.3 to 0.6 microwatts per meter squared. Okay, so they've written a letter to the WHO, and interestingly, WHO now has a electromagnetic hypersensitivity core group that does policy decision over electromagnetic hypersensitivity. But interestingly, most of the members are part of ICNOP. So what do you think, what sort of decisions are going to come out of this? Not very good ones. Okay. And these people have a recalcitrant denial of the research. And they have a close association with industry. Now, these are not my words. These are the words of the document. So there's no good, there's just bad, and there's ugly. As far as I'm concerned, when you expose the brain very closely for long periods of time to high power densities of electromagnetic and extremely low frequency electromagnetic radiation. And you can see the word ROS, that's reactive oxygen species. That's like the core thing that goes wrong. These reactive oxygen species just go, this is what I call the biological terrorist of the body. They just go and cause absolute craziness in healthy, biological, organized systems. And some people can end up with EHS in the upper right-hand corner, or they can end up with cancer. And so the experts are trying to alert at both an international and a personal level to reduce your exposure to EMF. Peter Diamandis, who's the chairman and the CEO of the X Prize Foundation, we've been talking about 5G. This guy is saying, and you know, this is more than likely what's going to happen, 5G is going to connect all of us. Is that a good thing or a bad thing? Well, on one level, one might say, well, that's quite a nice thing. But on another level, that opens up Pandora's box of exposure to these electromagnetic fields. He speaks about balloons connecting all of us, or 8 billion of us from space, that they're going to be space-based networks covering all the light spots. What a beautiful description. When we were at Steve's place today, I call them green spots, but light spots, absolutely. So there won't be any light spots left anymore. Okay, so let's finish off, guys. I think we've done this, hey? We've done this. So the science does not go to establish, remember I mentioned this in the Alpanza Standard, where they say the science does not at all establish even indicative parameters on which a precautionary approach may be based. I believe it does. And I think I just stand as one of many, many, many practitioners, many researchers, one of many scientists who undoubtedly believe that unregulated exposure puts us in harm's way. And the reference has to be tightened. We have to be protected. We need to wake up. The death of canaries in 19th century coal mines was the first sign that the miners must get out of that mine as fast as possible because of carbon monoxide poisoning, or our chronic fatiguers, or our electromagnetic hypersensitivity patients, the canaries of the 21st century, suffering and dying while we debate the nocebo effect and whether they got sensitization issues, while this tsunami of electromagnetic promiscuity is engulfing us. We must recognize and rescue those who are injured. We must recognize the research and continue to do research, but it mustn't be overlooked. And we must make the changes regardless of the cost. And using the precautionary principle, if we protect those that are most vulnerable, being our children and those that are very unwell, then we will be protected too. We need to wake up. And thank you, everybody. Thank you very much.